All right. Hello and welcome to our sixth regional report out here for the North Central region of Kansas. We're here every week at 2:30 on the live on this YouTube channel. And you can also sign up, and I encourage you to sign up at our website. It is covid.ks.gov/report-outs. And Megan, if you can make me the host, I'll share our screen here at covid.ks.gov/report-outs, and you can sign up to be a part of that. Let me show you what that website, I've never really shown you what the website looks like, so I thought I'd do that this week. So you just come here, put in your email address, click North Central, and you'll get an email with this call and the dashboard attached. Our friends from the Kansas Hospital Association put together, and any other kind of pertinent info. And you can also see if you need to go back and look at any of our past calls, they're all on here also. All right, let's go to our dashboard. This week, generally pretty good news across the state, and North Central Kansas is included in that here. So let me just kind of run through the numbers as compared to last week. So this first number here, we're showing no hospitals reporting staffing shortages because of COVID, which is good news. There's still some issues in the state, and it's still popping up here and there, but not near the pinch point that it had been the last couple months. So we come here and we look at COVID or suspected COVID patients in both the hospital and ICU. We want these numbers to go down week to week. Last week, this number was 82, and it's down to 52 this week. That's hospitalized COVID patients in the North Central region. ICU beds for COVID patients was at 6 last week. It's down to 4 this week. And then we want these numbers to go up. Adult staffed ICU beds from 13 last week to 16 this week, which has moved us from 46% to 57% capacity here in the North Central region. That's great. And more great news down here. These are new cases for the week, down from 700 2 weeks ago, 830 last week, down to 521 this past week. So that's really good to see here in the North Central region, people having good behaviors and driving good results. Here on the second page, you can always see percent of the population of these counties that have tested positive, and then their census of ICU beds, seeing that more than half available, which is really great for this region. So that's good news. I also just want to point out one other thing here. If you go to the website, kansasvaccine.gov, remember that vaccine has 2 C's, kansasvaccine.gov, and you click on vaccine data, you'll see the state dashboard on the vaccine. This will get more and more interesting as the weeks go on. People vaccinated, doses that are coming into the state. This number does lag a little bit. Like, I know we're over 125,000 as of yesterday, but because of the way the data reports through, this number always lags a little bit. But you can see the number of doses administered, first dose and second dose, and the percent of a population, then by the Pfizer or Moderna, and what's going on there. And then you can see also the kind of what's going on with first doses and second doses week to week as we move through phase 1. And this will continue to update this page, but I wanted you guys to be able to see it since we talked about it last week. And so we have our regular crew and a couple special guests here this week. So let me kick it over to Carrie Ann from Ellsworth Public Health to give us kind of an update from the public health perspective. Carrie Ann.
Good afternoon. I don't have a lot, I don't think, really to update on for this past week. I think the health department's main focus now is just vaccines, how we're going to get all of those out. If we start seeing any that become available, we're crossing our fingers. We can maybe start opening up that a little bit. Obviously, the calls are rolling in, people wondering to know when, how many, when will they get it, what category do they fall in. So I think across the board, that's what our health departments are busy with right now, is fielding all of those calls and just figuring out how we're going to proceed from here with all of the vaccinations, and just not knowing exactly how many we'll get or when we'll get them. To me, I know causes a little bit of a headache. I have a little bit of anxiety not knowing. I like to plan, but we'll go with the roll and hopefully just get them all out there. So exciting day for us in our office. We are all now fully vaccinated, got our second dose today. So that kind of seems like a relief on our shoulders lifted. So
and here you are to talk about it. That's great. Look at that. Congratulations. That is a big day around there. So we're hearing that we're getting close to being able to move from stage 1 to stage 2 in the vaccine rollout. That's decided by the governor and KDHE. And we anticipate that in the next week or so. And when we move to phase 2, just a couple expectations. So there will be a much larger population in phase 2 than there was in phase 1, and we're still having kind of the vaccine drip into the state versus kind of flood into the state. And so phase 2, the way that it rolls out through your county will be up to your county health administrators and the Board of Health there. And so you will want to be paying attention here in the next week to your county's local public health department with what the plan is. And obviously, what Carrie Ann said, no one knows exactly how much they're going to get or how that's going to look, but they're putting together their plans. And once the state tells them that it's go time, you'll start to hear the plans for your county. So be paying attention to your public health department. Is that right, Carrie Ann?
that is correct.
All right, perfect. So usually we have Heather with us to talk from the hospital perspective this week. Standing in for her is Audrey Dunkel from the Kansas Hospital Association. Audrey has helped organize all these great dashboards for us and has been a great help. And we're really glad to have her here. But Audrey, can you give us an update from the hospital side of things?
Sure. Thanks, John, so much for having me on. Looks like North Central Kansas, obviously, we see things are improving. And in a lot of areas of the state, they are improving. The big issue, not surprisingly, is we're getting a lot of questions about vaccines, how we participate and assist in getting those vaccines put out. But I know we're going to have some conversation about that. So that's really what's happening with our hospitals right now. I'll turn it back over to you, John.
Yeah, thank you very much, Audrey. Appreciate it. See, this is great. Giving everybody a little bite-sized pieces here. So, so let's pass it over. We have Dr. Watson with us from Cheyenne Mountain Software, the mission control software that helps with the transfers across state. He's been with us before. Dr. Watson, let me make you the host, and you can update us on what's going on with the transfer situations across the state.
Well, great. Thanks, John. And capacity, much better situation than we've been in the past. It certainly has provided us more of a breather as far as what the situation is moving patients around. Where we've typically had all reds in here, that no capacity, we're now seeing that people are critical capacity case by case, and even some returning to normal capacity in some regards. So it is variable, and we've had days that have been worse than others, but definitely some breathing room. North Central seems to be actually moving a little quicker than the rest of the state in smaller numbers. I think we're seeing that the percentage of COVID patients we're moving and the percentage needing a bed are still the same, but fewer numbers by far. And I think, again, that speaks to just the overall condition in the counties that are in the north central part, that before they were kind of caught between the western part of the state, which is recovering quickly, and the eastern part of the state, which is really lagging behind. So they look like they're turning the corner, and I think this is a good sign, and hopefully this will take us through the vaccine period into the spring, and that spring spike will not be a spike. So hopeful there.
Thank you very much. And Audrey, thank you, Dr. Watson. Do you want to introduce Brent Martin as our guest here from the boots on the ground perspective?
Yes, so we have asked Brent Martin to come provide us a boots on the ground approach from a rural health center. So Brent, take it away.
Brent, I think you're in Republic County, right?
That's right. Can everybody hear me? I had to pull you up on the phone here.
We're good.
Everybody here? Okay. All right. Yeah, Republic County Hospital up in Belleville, Kansas. So we're 7 miles from Nebraska and center of the state. But, you know, I think our biggest story, two things. We rolling out the vaccine to our staff. We are now at 71% of our staff is vaccinated. So we're really happy with that, which kind of seems like it's hitting some of those national averages that they predicted that we might get. So we're pretty darn happy with that. And then our real big story really is the monoclonals. We've given 60 of those, and you know, you don't know what effect that's going to have, but we know that that's had a huge impact on our number of hospital admissions, because that's just coincided with the more of those we've given, the less we've had, and that's then had a huge impact on our staffing. Helped us to resolve some of those issues that everybody's feeling on a day-to-day basis. So the monoclonals are probably our biggest story, and then we're pretty darn happy about the vaccines, and of course looking forward to that phase 2. And I think there is a little bit of local chatter and confusion, just kind of how our school systems work here. We share a para staff from our para educators come out of one district that is shared by multiple districts in different counties. And so as those counties are doing different things, talking about preparing for phase 2, it's rolling out to the other counties through that para staff. So it's creating some I guess, questions or concerns, because everybody does it a little different. And so we're going to have to work through that on a communication basis. So any advice there, we would love to hear and work to apply that phase 2 piece.
Yeah, and I think there's more communication coming out this week around vaccine and vaccine distribution for the counties and all that. So hopefully they'll be able to create some clarity around that. But it will be, something for people to be listening to their local counties to hear what their game plan is. Now, I do know that I've heard Dr. Norman say that county lines shouldn't be taken into consideration as much as the vaccines being distributed versus,
Right.
Who needs it. And so that's about all the help I can give you this week, but I'm hopeful over the next week we'll have more clarity around that.
Yeah, I think it's just trying to figure out if, I guess, for lack of a better term, and maybe even just lack of knowledge on my part, just how to prioritize that phase 2. So I think we're just learning and trying to do our due diligence and learn from each other and help each other out the best we can. And what one county does, the other county next door does it a little different. So,
Yep, I do think that's how
school districts that share that para staff across 6 different districts, but they're centered out of one main school district with the contracts. That's where we're noticing the communication is just trying to be consistent.
Yeah, that's a good point. Carrie Ann, did you have anything to add on that conversation?
I don't think so. I know from the health department standpoint, just, we've been lucky here. We built a really good relationship with our local hospital. So we've actually formed a committee together on how we're going to get these vaccines rolled out and how we can work together on getting as many people vaccinated as possible. So I think the key is just working closely with one another, and that line of communication just has to be an open one. So.
Yeah.
And
continue to collaborate. Yeah, that's the key. Collaborate, and just some simple things. People maybe get frustrated because somebody didn't answer an email, and it's just those simple reminders that they're boots on the ground. They're doing other things too. So we're getting there.
And I do think from what I'm hearing, if you're working in one county and living in another, or things like that, I encourage you to get in line in whichever county gets to your section of where you qualify first, just so you can get the vaccine out there. So, but hopefully we'll get more clarity this week. And Brent, just really appreciate your spirit and all that you guys are doing up there. We played Belleville in the state championship when I was in high school, so you got a special place in my heart. We beat you once,
right.
you beat us once, so
Yeah,
we're all even.
that's right. Cool.
Yeah, thank you very much. Let me kick it over to Dr. Duvey here from KDHE. She's helping lead the testing efforts in the state, and testing obviously still important as we're trying to roll this vaccine out as fast as we can. And asked her to give us an update on what's going on there. Dr. Duvey?
Thanks very much, John. While I share my screen, I'll just give you a little update. We have reached 2 million tests provided in the state of Kansas, and reaching over 1 million Kansans, actually. So We're really thrilled about that. We have a lot of work to do still. Sorry, I'm going backwards here. I should have. We have a lot of work to do still. And so that's what I'd like to talk to you about today. So we're going to talk about the role testing plays in the response, where I can find a testing site, how the testing strategy in Kansas is evolving, and where we would really appreciate your engagement. I think, Brent, you mentioned the monoclonal antibody. Without testing as a tool to identify people who may be mildly symptomatic, but test positive, who may have an at-risk condition like diabetes, or perhaps they're, over the age of 65, it might be too late by the time they got identified to even have access to that antibody treatment as an outpatient. So testing is really critical to identify those individuals who are at risk, who may have mild symptoms, maybe early in the course of disease, so that they can get appropriate treatment, but also important to reduce the spread by identifying those who may be asymptomatic. As we know, 50% of the people who are impacted by COVID are. So identifying people who are positive to prevent ongoing transmission in their place of work, their family, to their loved ones. Also, working, with staff at nursing homes or other congregate settings to really understand, who's positive, to remove them from an environment where perhaps there are a lot of folks who are at risk by virtue of their age, underlying conditions, or just the fact that they live in close quarters and really cannot effectively socially distance. And then we talked about treating symptoms. That includes, though, for those hospitalized patients, identifying who's positive so that they can really get appropriate care for COVID. And hospitals are doing a great job with testing. And many of our communities are also doing a really fabulous job with testing. And then testing is important for economic recovery as well. It provides confidence to return to work and school, knowing that somebody who may be positive is identified quickly and you prevent ongoing transmission in those settings, and restoring confidence to Kansan consumers who need to care for their families, go to the grocery store, or take somebody to a doctor's appointment. And I've heard people ask, are we going to need to continue to test now that we're vaccinating people? And honestly, it's probably, we're going to need to have a strong drive with testing until we get to the very end. Because we're going to need to continue to identify those pockets of COVID, even when we are, at higher levels of vaccination, so that we can stamp it out and prevent that ongoing transmission and really continue to vaccinate and allow that herd immunity to kick in. So keep testing. So where can you get tested? These are testing sites, a part of the Test All Kansans community testing program across the state of Kansas. The green are mass testing sites. Most of them are run by a vendor called Well Health. There are a couple that are run by Nick USA. Community testing partner sites, those are FQHCs, our community health partners, hospital partners, and then public health department testing are the yellow dots. And there are some mobile testing units that actually go from site to site as well. So you can see from this map that there are some gaps in coverage, and we're really going to be laser focused on how we get testing to every county in Kansas. And if you've seen one county, you've seen one county. And so we're going to need to have options that counties can tailor to their particular needs. So we would like to improve testing access by partnering with local organizations to expand the opportunities for people to get tested. We'll do that with a menu of options for local health departments because we know one size does not fit all. So working with local health departments so that we can help you create a testing program that responds to the needs of your community. We are engaging with local organizations now, including faith-based organizations, those trusted organizations in the community, so that people who perhaps haven't really wanted to get tested because they're concerned, they're worried about a big testing site, may feel more confident going to a faith-based organization or a local health department or another community partner for testing, a trusted member of the community. The Kansas Department of Health has purchased some mobile testing vans, which will allow for more agile deployment in response to outbreaks, outbreaks in communities, outbreaks at congregate living settings, or in communities where we've identified perhaps a risk using wastewater testing and looking at viral loads. The other thing that we're piloting now, and we hope to expand, is using mail-in saliva kits that we drop ship to local health departments. They can use these kits, give them out to people who call who are concerned, or perhaps use them to, host a community testing event. The kits can be taken by individuals to their home. They can do the specimen collection at home and mail them back to the lab. So we really wanted to spare local health departments having to actually do that collection themselves. And we know that working with our vendors is going to be really critically important here to improve patient experience. The turnaround times have been too long. So now we're transitioning to work with local Kansas labs. And we'll eliminate that transport time and hopefully get those results back within 48 hours so that they are actionable and we can actually get people isolated and prevent transmission. If there are vendor issues, we would like to hear from you, and we will continue to do quality improvement around testing sites. We're also dispensing rapid antigen tests to schools, to local health departments, so that we can use all sorts of testing tools and opportunities for getting people tested. And then the mobile units, as we talked about, we're really excited about those. So we ask for your continued support. Many of you have been great partners with KDHE in supporting testing sites in your communities and doing testing at your local health departments or at your clinics. And we would like to encourage you to continue to work with us. Or if you haven't yet established a testing site, please let us know if you're interested. We would love to work with you. If you have testing sites in your community, be our eyes and ears. We can't really be everywhere, but give us feedback. How can we do this better? If you have ideas, we would like to know. And importantly, leveraging those relationships with you and other trusted members of your community to help people feel more confident in testing. And while we're testing, making sure that we're encouraging vaccination and all those other things that we need to do, wearing masks and socially distancing and good hand hygiene to keep our communities safe. Here is some contact information. If you have any questions, just please let us know.
Thank you, Dr. Duvey. We appreciate that. So before we wrap up, any members of the panel here have any questions or anything they'd like to add to anything that's been said today?
I just want to let Dr. Dewey know that we've been using the saliva kits here for the past couple months, and we've had really good luck with those, pretty quick turnaround with results. And of course, our population loves them, so they don't have to have a nasal swab done all the time. So that's been a good asset, and we found it very easy to get started with the lab that we were assigned. So we've had very good luck with that. So
thank you, Carrie Ann, for sharing that. Appreciate it.
Thank you, Carrie Ann. Appreciate that.
And I think I just want to reiterate what I did last week with, even though we're getting these vaccinations out there, I still think that people need to be educated that we can't let our guard down. We can't see that spike again. So we still just need to encourage members of our communities to wear the mask, social distance, wash our hands, stay home if you're sick. I don't think we can reiterate that enough. So.
Yeah, I think you're right. And really the way this is laying out now is people may have read there's a more contagious variant out there. It's really wreaking havoc in other parts of the world and in some other states in our own country. And most scientists would believe that it's already in Kansas, but it hasn't become the dominant variant in Kansas. And so really what we're in a race between is how quickly we can vaccinate our population and how quickly we might see another rise because of that more contagious variant out there. And so to stop that from really being able to take hold. Staying with those mitigation efforts is critical right now, as we're really in that window. If we can stay strong and recommit ourselves, we can get to the other side of this thing. So, thanks for bringing that up, Audrey, Brent. Anything you'd want to add? Dr. Watson? Nope. All right.
I
A bright
just
spot.
want to say thank you. Appreciate the input.
Hey, no, we appreciate it too. I'll just share one bright spot. We like to catch people doing things right. This one, from the area, or just down the road at least. So there's a couple of gals in Wichita. A gal named Amy Sharash had both her parents get COVID, and she wanted to feed the folks in the COVID unit. And this was on KSN News this week. And she put it on Facebook. Amber Tracy jumped in with her. The two of them started a GoFundMe page that you can find under Feed the Healthcare Heroes. And they've been getting them snacks and food and gone all over State Council Grove and Overland Park and Wichita and Newton. And so they've just been getting food and showing people that they care. We know that the fatigue has been so real for our frontline workers. I just love their quote. They said, they keep telling us thank you. And we're like, no, all the thanks goes to you. You are the ones doing this. You're the ones saving families and saving lives and putting your life at risk to do these things. And I just love that spirit and that people are stepping up to care in that way. So their GoFundMe page, if you want to participate, Feed the Healthcare Heroes. So love that bright spot. We'll be here next week, 2:30 North Central Region. And thank you everybody for giving of your time today. Have a great week.